Hi, I'm Dr. Kevin Haney. I'm the Medical Director of Ozark Regional Vein and Artery Center. Today we're going to talk about the CEAP classification, which is a way of stratifying severity of venous disease. The CEAP classification is a way of grading the severity of venous reflux. It's a 7-step process, and some people start at early stages and they progress as they age to later stages, and some people stay at early stages the entire life. CEAP 0, we hardly ever see those. They come in, they have a perfectly looking leg, and they have venous reflux and a lot of symptoms to go with it. CEAP 2 is where they have backwards flow in the greater saphenous, and they have bulgy veins that raise the skin up. Generally, insurance, if there are symptoms to go with it, they're usually on board to fix it at that point. CEAP 3 is all the things of CEAP 2, plus they have some swelling around their ankle. If it's out on the foot, then we may be talking about lymphedema or some other condition, but if it's up around the ankle and it stops at the ankle and it doesn't involve the foot, then it's probably venous edema, or there's a decent chance it could be. CEAP 4 is more advanced. It's where you start getting skin damage. And CEAP 4 now has been broken into A, B, and C depending on how severe the damage is. So someone just gets a patch of brown skin along the inside of their calf right above the ankle, just a little bit browner than the rest of it, still soft, and you can push on it. It's not terribly tender. That'd be in the earlier stages of CEAP 4. The more advanced stages of CEAP 4 is where it starts sinking in and the skin gets really thick and leathery, and it's hard as a rock. Because the fat underneath it has died, the skin is getting thick and leathery, and you're just pushing against something that's very, very hard. That's a scary level that you really probably ought to get it fixed once you start getting discoloration, because when CEAP 4 level patients advance, they jump to 6. 6 means a patch of brown skin with a hole in it or an ulcer. And the ulcers can be variable sizes. I've seen them the size of a dime. I've seen them the size of a softball. But the venous ulcers are a really big mess then to fix, and it's because we didn't address the problems when it was at an earlier stage typically. And once you're a 6, the best you can hope for is to get the ulcer healed, at which point you go back to a 5. The brown skin is there to stay. That's permanent scarring. The ulcer will probably heal if you fix the veins, and it may stay gone for a long time. If you don't fix the veins, sometimes you can get the ulcers to heal with wound care, but they often come right back. They'll be back in months or 6 months or a year or whatever. And so if you can fix the veins and you fix the reflux and you decrease that pressure and you get it to heal, that person's chance of ever getting another ulcer goes down about 80%. So you want to treat the people with ulcers. You want to treat the people that you think are headed toward ulcers, which would be those CEAP 4s. The 2s have a lot of symptoms as well. It's easy to fix those, but a 2 can go back to a normal looking leg because you don't have anything permanent there. So once you've addressed the bulges, you've addressed the cause of the bulges, then they're probably going to have a normal looking leg again. So it's obviously better to catch them earlier stages because then they're going to go back to having a perfect leg. Obviously you have venous ulcers, you need to be here, but you need to be here yesterday instead of now. If you think you have symptoms related to venous reflux, go to our website, fill out the screening quiz.